Hello, and welcome to Health Talk Show presented by Tulip Mediworld Super Speciality Hospital, Guwahati, Assam. Today, we are addressing a topic that's often misunderstood and feared: brain tumors. Joining us is Dr. Arindom Kakati, renowned neurosurgeon and director of Neurosciences at Tulip Mediworld Super Speciality Hospital. A warm welcome to our show, Dr. Kakati.
Thank you, Supriya, for having me.
Thank you, Doctor. So, Doctor, let us begin with this topic. When we talk about brain tumor, it always feels like very scary topic. But however, we would like to address few of the questions we have received from our audience. What exactly is brain tumor, and how to diagnose this?
Okay. A little bit technically defining it is that a brain tumor is an abnormal mass of tissue growing inside your skull, which is unregulated and persists in the same manner with treatment also without treatment also. Meaning
Right.
you're growing, but if it grows abnormally, it becomes a tumor. So
Okay.
kind of like that. And how exactly to identify them? There are some pointers, some clinical features that people need to keep in mind, that these can be ominous signs. Like headache, everybody has.
Right.
One of the commonest symptoms of brain tumor is also headache. But these headaches are a little bit different from normal headaches like migraine or tension headaches and all. Brain tumor headache, since it is growing inside your skull, the headache becomes more and more over time. Okay. And other thing is that these are also produce raised ICP headache, meaning the pressure inside your brain is also increasing. So you'll have associated nausea, vomiting. These headaches are more in the morning period when you get up from bed.
Okay.
So if you're having a persistently rising headache associated with nausea, which is increasing over time, then you better get evaluated, because this could be brain tumor, not always, but could be.
So all headaches, is it alarming?
No, 95% of headaches are not alarming.
Okay.
So if you have the features that I have already explained, then you should get evaluated, because in that case it could be. If it is treated at an early stage, the results are also better.
Okay. So, doctor, how to evaluate? Like, what are the evaluation process if we are facing symptoms?
Yes, good question. The basics of evaluation starts with meeting your doctor, having a clinical evaluation, whether he thinks your symptoms are serious.
Right.
And if he also thinks your symptoms are serious, then get a scan done. MRI is better, but CT scan will also do.
Okay. Okay. So, doctor, like as we as a layman, we always feel that if we hear the word tumor, we immediately feel that it's a cancer. So, does all tumors are cancerous?
No, not at all. Present statistics says that around 50% of brain tumors are benign. Benign as in they are not cancerous. And good news about these benign tumors is that the outcome following any surgical intervention also, people can go back to normal life in almost 90% of cases.
Okay.
So, of course, the other part of the 50%, which are the high-grade tumors, we call it. Basically, in brain, we do not call malignant. We call it high-grade tumors.
Okay.
So, in those cases also, depending on the location when it is diagnosed, the outcomes can be very much different. And there's also age at which you are being diagnosed. So, all these conditions. But as a whole, 50% are not bad tumors, 50% are good tumors.
That's a good sign. That's a good news actually for us. So, what causes brain tumors, doctor?
Most brain tumors, unfortunately, we do not know what causes. Those are spontaneous.
Right.
There are some hereditary conditions like von Hippel-Lindau or Li-Fraumeni syndrome, but they are very rare. 90% of brain tumors are spontaneous. Some are associated with radiation. People who are exposed to too much of X-rays sometimes develop. And there are myths like mobile phones cause brain tumor. We haven't found any scientific proof to that.
Okay, we can use mobile, really.
As of now, yes.
Okay, all right. So, symptoms and warning signs. This is very important for all of us to know. Like, what are the symptoms and warning signs you will, encourage people not to ignore?
Very good question. As I told you, number one is headache, the kind of headache which is ominous.
Right.
Other things are like, because of the brain tumor, certain growing at a certain part of your brain, that function of that part of the brain can get affected. So you're developing new onsets, say weakness in a hand, or you're developing new onset epilepsy, seizures. You never had any seizures. Suddenly one fine day you're starting having seizures. And there are subtle behavioral changes which suddenly starts. Supposing you are becoming more and more aggressive, or you're becoming more and more depressive. So those kind of behavioral changes. So if you notice those kind of things, because everything depends on where exactly the tumor is growing and what is the function of that part of the brain.
Right.
So if it's growing in the back of your head, you can have vision problem. So new onset neurological problems, if you are developing, you're having seizures or you're having increasing headache, these are the signs that you should not ignore and get evaluated with the doctor.
I'm very curious to understand one thing. Whenever we have a headache, as we know that self-medication is very dangerous, but often we see that people will try with paracetamol or medicines, painkillers, if you're having any headache and all. So what would be your advice on that?
No, I have no issues with that. Meaning headache, as I already told you, 95% of headache is not bad headache.
Okay.
Nowadays, most of the headache is due to stress and those things. So if it helps you, those medications, well and fine. If those medications are not helping you, you're requiring more and more of medicines over time, then you should discuss with your doctor that it could be something else.
Right. Okay. Okay. All right. So now, once again, just to recap the same thing with our audience, when should someone see a doctor?
Number one, headache, which is progressing in nature. Number two, if you have new onset neurological symptoms, may it be weakness, numbness, or your behavioral changes, or vision problems, and any form which is causing more and more progressive neurological problems, you should get evaluated. At least consult a doctor.
Right. And doctor, one important thing, is biopsy always needed? Because that is also a concern. Many people, they think that biopsy, that means it is like going towards cancer or something like that. So is biopsy always needed?
No. Sometimes, like some tumors are there, like lymphomas, or you have meningiomas or schwannomas. These kind of tumors, we are very sure what is the diagnosis looking at the MRI itself.
Okay.
In those cases, usually a biopsy is not required. And if required, these tumors also, the good thing is that if they are small enough, they can be treated without surgery.
Oh, that's
focused radiation is available, what we call is cyber knife, gamma knife. These are stereotactic radiosurgery. Focused radiation can be given and you may not require surgery at all.
And when is the indication for a surgery? Like if I would like to know about the treatment modalities for tumor. What are the options?
The main goal of surgery is two. Number one is to get the diagnosis, if you have a diagnostic doubt. Number two is to give the brain space, and so that the normal functions of the brain comes back, as well as the pressure inside the brain comes down. So those are the indications for surgery. Depending on the tumor, then again you have to decide what to do. Like gliomas, which are the high grade ones, which have already spread everywhere. So then the goal of surgery is mainly to give the brain space. We call it decompression.
Okay.
Whereas in the case of benign tumors, which I've told you are 50% of the tumors, so in those cases we go for total excision, because that will give the patient complete cure. It does not require to do anything else. However, in the high grade tumors, after surgery also they may require radiation depending on the diagnosis, plus minus chemotherapy also.
Okay. So lastly, we would like to know one more thing, that is brain tumor surgery is dangerous?
Not at all dangerous. Of course, certain location brain tumors have increased morbidity following surgery. The possibilities are there, like tumors in the brainstem or very deep-seated tumors. But fortunately, those are rare. Most tumors are mostly in accessible areas, and nowadays surgery is quite advanced, and accessibility to area can be achieved without causing too much morbidity to the patients.
Wonderful. So, at Tulip Mediworld, a neurosciences department, how you manage this kind of neurological issues and especially brain tumors? How do you work here?
Of course, like all hospitals, we start firstly by talking to the patient, clinical evaluation. Then we form a generalized opinion on what is the problem. Then we have all the facilities to evaluate those opinions. Like most commonly, the required investigation is an MRI with contrast. Following that, if the patient requires, supposing the patient requires surgery, and tumor is located in certain important areas of the brain, which if damaged during surgery, what we call as collateral damage.
Right.
Reaching the tumor, you may need to go through certain important structures. And doing that, that part may be damaged, and patient may invariably end up with some new issues which were not there. So to prevent those, we have neuronavigation. So it's kind of a GPS, where you can locate your target and you can decide which route to take. You decide on a route which is least invasive to the patient, and that way you can reach the tumor, to take out the tumor and cause least amount of damage to the brain. Also, other facilities like awake craniotomies are there nowadays, which we are doing. So in that case, the patient remains awake during surgery, can talk. So especially in lesions which are located near the language area or near the motor cortex. So in those cases, while doing surgery, you can stimulate that area and find out if we go through that area, it can cause damage to the patient. So we can stimulate that area and ask the patient to write something, or some squeaky toy we can give them. They can press it on command. So if the problem occurs, then we avoid going in that area. So these technologies are there, and we have microscopes to enlarge the view so that you can see exactly what you're cutting and what you're not cutting. So technology helps us a lot, and that leads to better patient outcome.
Wonderful, wonderful. Thank you so much, doctor. It is really very important for all of us to know that symptoms should not be avoided, and early diagnosis will definitely save a life.
Correct.
So, doctor, what would be the last takeaway message from our discussion, if you can recap for our audience once?
Main thing that we all need to understand is that you should not get scared of brain tumors. Brain tumors, most of the cases are treatable. And most important thing is to identify them and diagnose them early and get what is the relevant treatment done as fast as possible. Because 50%, as I told you, are already benign tumors, which can be treated and has a very good outcome. Even you have the other part of the 50%, which are high-grade tumors. If diagnosed early and treated accordingly, you can have a very good chance of a good life. And that is the thing that you should know.
So thank you, Dr. Kakati, for this insightful discussion. Remember, early diagnosis and early detection saves lives. If you or your loved one is experiencing unexplained neurological symptoms, don't ignore them. At Tulip Mediworld, our neurosciences team is here with the latest diagnostic tools and surgical expertise to offer hope and healing. So until next time, stay informed and stay healthy. Thank you so much for watching this show. Namaste.